Just waiting for me to begin, Miss Heather.
No
Yes,
worries.
sir, sure am.
Okay. So my classic lead in is the dates because I hate reviewing something and not knowing the date. So August 8th, 2025, we have the great uh, Amy Dixon in the office today. She'll be presenting with us. Today is going to kind of be a little bit more informal. She's a wealth of knowledge. I'll give you a little bit more about her background here in a minute. She's very similar to us. It just never ends. Her education never ends, and she is of pursuits. She is a student. So she'll be an excellent resource for us today. If you guys do have questions, we do kind of want to answer them as we continue to go through the lecture today, but please put them in the chat. That way, if they're in the chat, that way we can answer them as we continue to go on. Miss Amy Dixon is about 40 minutes away from me. I'd like to, if she was a little bit closer, but it kind of is what it is. We have multiple patients that we share. Probably the most notable patient that we have is my wife. She did a full assessment and she did some treatment with my wife, and that was just eye-opening for me. Uh, she's very, very thorough. She's very good at what she does. She's very good at implementing the all around the whole body approach that we're looking for. The Scolio Pilates was actually introduced to me by DW, so Dennis Wogan. Dennis Wogan was the founder of the Clear Institute, and we talked about scoliosis and Pilates, and he turned me on to that organization, and that's how I found you, Miss Amy, was through Dennis Wogan, who's no longer with us. He passed last year, but he talked to me a little bit about it, and it was just phenomenal and amazing what you guys do. And so in my world, what we see is a lot of people that treat scoliosis, but not any, or a lot of doctors and people that treat people with scoliosis, but not necessarily treat and work with scoliosis. And so it's been very difficult to find somebody, even chiropractors, or medical doctors or Pilates instructors that treat scoliosis and not just treat somebody with scoliosis. And so it's been great to have you connected and be able to see our patients as well. And so I know that you kind of have a lecture or a discussion kind of planned, and I kind of want to chime in here and there and ask you some questions as we go through. But I'll let you go ahead and introduce yourself as well.
Okay, great. Thank you so much for having me and allowing me this time and space. My name's Amy Dixon, and this is Teresa Wooten that's here with me. She has been a massage therapist in my studio for 18 years now. When she first came to the studio to work and wanted to do Pilates, and we realized she had pretty severe scoliosis, I really didn't know what to do with her. There's not a lot of guidance in the fitness or Pilates world at the time to handle scoliosis and any contraindications and so forth. So it forced me to step out and start looking around and seeing what I can find. There's so much conflicting information out there, and it's even more so now, what to do or not to do with scoliosis. So that's just led to the last, I don't know, 15 years probably of been mostly my concentration now in my studio is working with people with scoliosis. And just like you said, it's interesting. There's so many times someone comes in with SI joint dysfunction or anything, and they've been seeing a PT. Well, what kind of exercises are you doing? Oh, well, XYZ, whatever, the McKinsey extension method or whatever the program or protocol of the day is. And well, that's maybe not the greatest thing for scoliosis, right? Maybe, it'll help temporarily help the herniation, but you know, scoliosis is happening in there. And if we don't look at that, then we're just not going to get the symptom relief. So, thank you for having me. A little bit about me, just super fast. I started out as an x-ray tech at 19 years old and decided it wasn't going to be my long-term strategy. Now I love that I have that background because I use it every day, but I knew I didn't want to do that long term. Working in the hospital and in the clinics was not my thing. So I started doing personal training at 20 years old and did both of those roles for quite a few years. And then when I was sure I could jump in with both feet into fitness, I left X-ray. And then working in the gym, working with healthy people, just got boring for me pretty quickly too. So I started working with people with issues and injuries. And back then, there was no internet to look anything up. So when I had somebody come in with, Osgood Schlatter's or whatever, I had to do the old-fashioned kind of research to figure out what to do. So that led me to lots of trainings and certifications through various methods to learn about special injuries and issues. And that was way more interesting to me than, screaming for more at somebody in a boot camp kind of class. So I'm not a purist on Scolio Pilates or anything actually, because I do have a lot of certifications and background that I kind of bring everything together. And I just call that modality movement restore. And it has a little bit of a lot of things in it. So you may find, Scolio Pilates in particular might look different somewhere else. If you find somebody in your area that does Scolio Pilates, it's going to be wonderful, absolutely, and you're going to get what you need for your patients. I just mash a whole lot of stuff, other stuff into the mix too. So I just wanted to let you know that part of it. So, what is Scolio Pilates? We are looking at the body from a three-dimensional perspective. It's exercise management. So, we don't really use the word treatment so much. So, we're looking at exercise management, safe movement, moving out of muscle imbalance the best that we can. There's always going to be some imbalance when the spine is not sitting dead center. Our core techniques are elongation and derotation and drawing toward the axial center. We know that in scoliosis, the alignment isn't favorable necessarily for strong function long term. We're working on corrective exercise program to try to use those 3 points with everything that we do. Cob angles might change, might not change. We don't ever promise to fix a curve, but we're working on those muscle imbalances and usually helping compensations, helping reduce symptoms and pain management. So the key to improving movement lies in alignment and joint centration and myofascial health for us. We work to find our strategies in finding the best alignment of the spine possible with stabilization to ensure ideal neurological feedback and activation of local stabilizers. They often get bypassed, right, with scoliosis. Stabilization of the thorax versus the pelvis to try to assist in proper intra-abdominal pressure. There's also often rib translation and scoliosis, and that affects organ function and lung function. Then we're also working on foot stabilization to support neuromuscular feedback, working on reflexive dynamic recoil, optimal extensor chain function, a lot of posterior chain work that we're working on, and myofascial health being essential and hydration to help with mobility and access to corrective exercises. All right, so we'll just like you guys, watching and waiting is sort of the thing that's out there that they're doing, in the doctor's offices, in the surgeon's offices. They'll just watch them until they're bad enough to step in and do surgery or brace or what have you. But that watch and wait season is a proactive time that we could be doing something. So that's what we're offering is proactive alternative to the passive watch and wait. We know just from our experience, Dr. Justin and I, our methods work really well together. You guys are working on the bones, we're working with the myofascial tissue, and it's been great for client outcomes that we've shared, quite a few clients in the last few years. So this is a picture of the backside of Teresa here. As we talk about curves, the curves are a major source of compensation that inhibit many muscles from functioning and firing. Curves are strong, of course, and the body lets those take over often. And compensation can last for a while until it can't, right? And then we start to get the little white flag of pain or dysfunction until we get a red flag of, stop, I really have to do something about this. So I work with education first and foremost because if they don't know why they're doing something, they won't adhere. They won't do the program. Much like you guys too. They've got to do some homework, right? They've got to follow up. The subtlety of this work can just slide right past them. They won't necessarily feel an increase in heart rate or a lot of exertion necessarily. A lot of it's mental and very subtle work. If we can get them, though, to commit to the daily work to counteract their daily life, they'll notice a taller stance, less pain, ease of movement, efficiency in their workouts, and their chiropractors and massage therapists tend to notice, and that helps just them with
And
their
there's no
body.
doubt, Miss Amy, with the patients that we've shared, that with our home care, you complement that. You ask for our X-rays, you go over our X-rays, you do
Yeah.
a really detailed physical. About I think it was about 45 minutes.
Hmm.
And in particular, we'll talk about my wife, and just in this case, after her one session with you, she felt like, oh my goodness, I haven't felt these muscles in years. And speaking with DW during this, when a scolio Pilates instructor put him in a position, it made him feel like they were in our scoliosis traction chair. It was that tight. It was making them move that much. It was just amazing.
Hmm. Hmm. Yeah, and just like you just talked about, so the first session, I'm going to be doing basics of X-rays. I'm not a radiologist, right? But talking about the basics of their X-rays. Oftentimes they come in, they've not had any education, not from you guys, if they come from you guys, but oftentimes when someone comes in with an X-ray, no one's talked to them about it, so they have no concept. So I'll break out my model, and we'll start talking about like what's really going on, and we'll talk about the activities of daily living. What are the best actions for their spine? What kind of things should they start to modify in their life? We start working with building a team, scoliosis trained PTs. We have a Schroth PT in our area now, just recently. She just completed training back earlier this year. So we started working together too. Chiros, of course, sports medicine doctors, massage, personal training, trying to develop a team for clients. In my evaluation, I usually do functional muscle testing, perturbation testing, looking for what muscles are atrophied or what's neurologically underactive, what's just not getting a signal from the spine. And then based on that information, I start to play around with wedges and props and see what's the best method to help muscles to fire and to wake up, reducing those inhibitions to movements. And then once everything's firing, sometimes that takes a couple of sessions. I'll give the client homework to help facilitate that work that we start in the studio. Our wedges, I think that I'm sure you guys have come across wedges in the past with other modalities. So they have several functions. From a structural point of view, they'll change the pressure on the connective tissue and around the joints and ligaments. And then this is followed by a neuromuscular communication change in the fascial tension, neural feedback, and proper proprioception. Also, a little parasympathetic response, just a calming influence to the tight muscles that are pulling the curves away from center. Right. And then once we have had a few sessions where they've started to learn the subtleties of some corrections just on their own, and they're practicing that with some adherence, we can start to get into the strengthening phase. So generally starting supine, no resistance, and working on strengthening from there. Once everything's firing, then we start to get into strengthening. We start with breathing exercises, of course, going back to the same focus that we talked about a while ago with elongation and derotation and axial narrowing. We start to tap into multifidus and pelvic floor diaphragm and transverse abdominis work, trying to get the primary stabilization group to work. We also often find a relationship with the older population. Maybe they had a diastasis from a long time ago, and now they have some pelvic floor dysfunction. So again, oftentimes they've come from the pelvic floor PT, no notes about a diastasis from ages ago, and then we start working with the scoliosis, and then their pelvic floor symptoms start improving. So it all becomes part of the work as we are putting the whole body back together. Then start looking at the posterior oblique chain. The lats are huge, of course. They're stabilization for the SI joint and the lumbar spine. So usually imbalance is happening, of course, because of the curve. And the fascia, the thoracolumbar fascia, is generally very tight and then affects the muscles and the mobility to access things deeper because it's so tight there. All right. Then, whoops, going into the psoas. So again, this is after they have a pretty good working knowledge. They understand their curve. They understand some corrections of their curve. And every session, we just layer and layer more and more work and address more and more muscles. So when we think about the lumbar curve and how the psoas sits in relation to that, of course, so as main driver of hip flexion and the connection to upper and lower body, the psoas attachments are altered right and left, right? So we know when like with Teresa's lower left lumbar curve, the spinous processes rotate back to the right concavity. So her left psoas is sitting deeper and shorter relative to the right. The right side's more elongated and superficial in her body. So this position is going to affect hip extensor function and mobility. So then we'll start working on some antagonist relationships to try to find balance and holding these new positions. So we work psoas and QL as secondary stabilizers once we get our primary local stabilizers to kick on. And then we start going into obliques and abductors. We work on diagonal patterns, anti-rotation work with that special focus on those three key points that I keep going back to with elongation, derotation, and axial narrowing. Right. Then we tend to step into some passive hip flexion. I'm sorry, hip extension. So you'll see here, it's kind of hard to see in the picture, but she's in passive shoulder flexion on the right with a yoga block and left hip extension with a yoga block. So we're working on that diagonal fascial chain to help with gait patterns. So that's simulating that opening diagonal pattern that we need. So we know that hip extension is going to look very different from one side to the other because of the lumbar curve and the position of the psoas and orientation of the lumbar spine. So we want to work on hip extension. Sometimes we just work on one side, depends on what the client needs. Just taking care not to further elevate one side of the pelvis or further rotate that lumbar spine. All right. And then at the end of each session, when we're doing an Adams test, of course, at the beginning and the end of each session with a scoliometer, retesting to make sure we haven't elevated a pelvis. We're trying to, of course, level that out as best we can, derotate the best we can through our pelvis so everything stacks above that as good as possible. All right. And then as you can see, there's Teresa again, when in her Adams test, I just had her stop at several different points so you can see some action in her spine. And then across a few more appointments, we start progressing through different positions. So once they have some supine strengthening down pat, we go through prone, side lying, kneeling to standing. So it becomes a very functional and a dynamic way for them to work. All right, so here in this particular position with her side lying, we're trying to have her elevate the left waist to draw that curve away from the table and drop her left ribs down into the table with as much elongation as she can find there. And then across 5 to 10 sessions, it just, everybody's a little bit different, but however much time they'll give me, I'll try to cram in as much work as I can. But each session builds on the previous one. So we're always working on stripping away the layers of compensation. Depends on their level of commitment with their homework, with their body awareness and understanding. We try to keep their goals in mind, whatever activity that they choose to participate in. We're going to work with some activity simulation to help them with safe movement and try to reduce some muscle imbalances. Perhaps if they are, an avid golfer or tennis player, something that's going to do some repeated rotation, especially in one direction there with golf, then we're going to give them some oppositional things or some stabilizing things to do both before and after their game to try to reset everything as best we can. So after We've gotten a few things under our belt. Then we'll move into spring tension with the Pilates equipment as well, trying to help reinforce some new patterns. Then we have healthy spine classes on our schedule 5 days a week, and those clients tend to funnel into those. So those classes are full of people with scoliosis or osteoporosis, stenosis, whatever, osis or isis they might be dealing with. So those classes we tend to keep pretty neutral on their movement scale. So here again is Teresa. I'm gonna give her a minute. I spoke at the top. So if you maybe missed that, just talking about she's been our massage therapist for 18 years. She was my inspiration in trying to find some training in scoliosis because there just wasn't much guidance of what to safely do in Pilates or fitness world. And so Teresa had adolescent onset and wore a Milwaukee brace. So I'm going to give her a minute just to talk about herself. And please, if you have any questions, there are more slides to come about her and some things that we've done and accomplished over time. But maybe give a brief, yeah.
Yeah, so I was 13 when they first found the scoliosis. I was scheduled for Harrington rods, but I jokingly tell people my mother was the massage or the exercise Nazi while I was in my first body cast, and she made me do exercises every day, which taught me the importance of trying to keep the posterior chain strong. Anyway, because of all the exercises that I'd done, rather than doing the surgery, they opted to put me in a Milwaukee brace, which I wore for 4 years basically, all through my high school time. So, uh, and then I got out, I went about life. I got married, I had 2 children, and I found massage school, gosh, 26, 27 years ago, close to where I was living at the time. And uh, it appealed to me primarily because my younger daughter also has the same backwards S curve that I do. So I started looking into ways that I could help her, not even really considering what that might mean for myself. Meanwhile, moved back to North Carolina, and shortly after moving back here and getting all the licensure stuff taken care of, I met Amy and started working with her. And I was thinking back about when I first started working with her. She used to say to me, straighten up that shoulder. The shoulder's always dropped when you come in. Straighten that up. Do this, do that. Just regular Pilates really didn't work very well for me. So she started looking at what she needed to do to help me to strengthen in my curves. I will say to everyone that menopause is the devil when it comes to bone strength, probably some muscular strength. And so about 5 years after I had gone through menopause, um, I lost about 4 inches of height. And, you can see where that is. And so we've been working really diligently for the last 4, maybe 5 years. No, it's probably longer than that, on really helping me make corrections and get stronger and stop losing height, basically, is what we've been doing. I've gone to Schroth therapists. I did one in Chapel Hill because when I was looking, there were only 3 certified Schroth therapists in the state. So I'm kind of excited for folks that there's one closer here now. But anyway, I went there for a couple of years, and then COVID hit, and nobody was allowed to see anybody face to face. So we were doing Zoom meetings like this, but we always did it here at the studio so that Amy could keep a closer eye on what I was actually doing. And I discovered that there were a lot of things that she was correcting the therapist. I've never told you that.
Oh.
There were things that she was correcting the therapist on, and the therapist was like, oh, yeah, that's a good idea. So, anyway, I stopped doing that because I felt like I've got some really good help and input right here. And I am correct on that conclusion. So anyway, here I am. I know we mentioned this earlier, but not so everybody could hear it, but I just recently turned 70. I am still doing massage here at the studio. I do see some scoliosis folks here, and I work with the fascial system primarily for releases. I do a lot of that for myself. And I, I don't feel like I really experience a lot of pain because of the way that I've been taught to make muscular corrections. And it is something that I work on a pretty consistent, almost daily basis for myself. I think that's it.
Does anybody have any questions for Teresa while we're here?
Yeah, I do.
Okay.
As far as your daily consistent basis, how much time are you devoting to this each day, just for yourself, Miss Teresa?
Um, 30 to 30 minutes to an hour. Just depends on how much time I've got in the mornings and what I have to do. I prefer to do the hour, but if I can't, then there are some basic things that I will do with some of the props that she's taught me how to use. So, but a minimum of 30 minutes, just about every day.
Mhm.
Excellent, thank you.
And that's not what a lot of people like to hear.
No, you guys know that, right?
Yeah.
It's okay. Our home care is excessive.
I know. I'm like, I see your clients and I'm like, my 30 minutes is nothing compared to the 2 hours that you're doing for Dr. Justin, right? All right. So a little bit more about Teresa. There's a bit of a posterior pelvic tilt that, sometimes it often happens. So the seated wedge sometime, and that can be a quick trick that you guys can employ with people if you don't already. For some people, it's wonderful. For some people, it's horrible. So it can be a trial and error sort of a situation. But a wedge seat's going to toss that pelvis a little more anterior, and then concentrate on the elongation on top of that. Sometimes it's just too much. Sometimes it's too much too fast, but that is a trick that can be quite helpful for people in a pretty hard posterior tilt. So when we talk about um, from the lateral side, with L2 often being the most posterior spot in scoliosis. So we've also done some work on trying to, because she really knows right where it's at in her body, and I can go in there and poke at her, then she'll try to sit on the wedge and take L2 more anterior, but then trying not to let that left rib hump further translate forward. So one of those other things that we're always talking about, elongation first, because if you just try to go in there and shift something, you're going to further compress and rotate the whole spine. And then we start getting into more and more challenging things with Teresa. So we're getting into work with more load into the Pilates equipment and more fun props. So the first picture there on the left, we are challenging with on the reformer with against spring tension. If you can see the springs that are there below her legs, so she's working against weight. The bar that her feet are resting upon, it pivots and swivels, so her feet can independently plantar and dorsiflex. And then the whole platform also swivels so she could hike or change the level of her pelvis. So ideally, we're trying to correct the elevated pelvis. And then simulate a sit to stand. So it's a lot of dynamic, different things happening all at once with the spring tension there. And then the middle picture, we're working on scapular stabilization. I kind of cut off part of that picture, but if you can see there, her left hand is connected to a bar that is loaded with spring tension, and then the reformer that she's sitting on has spring-loaded tension as well. So she has spring tension coming at her from both the right and left sides. So she is working here to depress the left shoulder, trying to find teres and serratus work, and at the same time breathe into that left thoracic concavity to try to take that the inferior angle of her scapula and pull it back out of that concavity.
That's a lot of work,
Yeah,
just so everybody knows.
it's
That is
tremendous work.
really difficult and it is a lot of work.
And these exercises are not something that we would do. I mean, it takes a while to get to this point too. So it's not something we're going to hop into in the first couple of sessions. And then the other picture on the far right, those are rotation discs. So they are very freely floating rotations. So she'd actually lie on her back with her head on the wedge cushion at the top. Her thoracic spine's on one rotational disc and lumbar is on the next one. Then her legs are outstretched with her heels resting on the balls, and she is applying downward pressure to find the extensor chain while trying to derotate through those discs forces at the same time. So she's working really hard when she's in that position. So sort of wrapping things up here, when we look at Teresa's x-ray, here on the left is her standing in a relaxed position. So if we see 11th rib sitting pretty close to that right hip there, we see L1 and L2 kind of doing their own little dance off to the left. What else we see? Oh, the inflare of her right ilium as well. When we look at the picture right next to it there, that's her corrected position. So I just had her under x-ray stand in as much elongation and correction as she could. So the horizontal line that you see across there is, of course, the same from one to the other, but the pelvis elevates because she's coming up out of that posterior tilt there. So that becomes a little bit deceiving, I think, at the same time. But we can see her bra clasp position change from the relaxed position to the corrected position. So there's one point. Then we see a little more space between rib 11 and the ilium on the right side. There's less inflare on that right side as well. And there is some improvement there on L1 and 2. You can see that. And so I did another slide of the same. Everything else is the same. I just added a vertical line here because I felt like it might better represent some improvements. So in her relaxed state, I dropped a line there on the sacral tuberance there. And where it comes up and intersects on the horizontal line is at T9. And when we did the improved position there, we were at T7. So she gained a couple of vertebral heights there just standing in her corrections. So she's able to find that just standing there pretty quickly in an x-ray, and she's pretty well practiced at this by now. And she'll stop when she's working, doing massage on a client and just stop and do her own little corrections all throughout. So the improved correction is more comfortable for her. It's more work. It's definitely more diligence. But the relaxed position is pretty uncomfortable for her at this point because things just hurt and things feel very squished on her. So any questions about any of that? That sort of concludes me. And my time. I can go back into these x-rays if anybody wants to ask or have a comment about anything. Are there any questions in the chat?
I have a couple of questions. I know at one point during COVID you were doing online classes. Are you offering those at all anymore?
I don't love them, but if we're
I
desperate,
know you're a hands-on
there's
person.
so much hands-on that I like to do, I do a lot of the muscle testing, so I need the in-person for that. So if I can get a hold of someone a couple of times and then work remotely, that's better than nothing, of course. So that's possible. But the hands-on is very valuable, I will say. But going back to what I said earlier, about Scolio Pilates and I do mash a lot of things together, but I know your group is all over the place. So if you find someone in your area, you're still gonna have great results with whomever you find. It's great work.
Gotcha. Um, and you mentioned, about injuries. I currently have a publication on the editor's desk right now about cervical instabilities and forward head posture in association with scoliosis. Are you working with the forward head posture
Yeah,
at
yeah,
all
yeah.
and bringing that back? Yeah.
Yes, absolutely. And Teresa doesn't have that issue, right? Because she's just been working on that so long. But often, of course, it is. There's often the kyphosis along with it, or just a translation, a shift, a rotation, whatever. These X-rays just don't really show much up in her C spine at all. So we just didn't make her get all of those X-rays since that there's not so much of an issue for her. But we talked about this a long time ago because she had braces in the last, what, 5 years. She had Invisaligns because of all that she had going on. And so, at one point we kind of went, oh, it's probably got something to do with your scoliosis. So a lot of, were you grinding?
Oh,
There was a lot of grinding going on too. So, yeah, definitely it all goes together and we work on the whole body. But I start with the scoliosis and then work my way out. Mhm.
Does anybody have any other questions? No. Okay. Um, do you happen to have a video of common exercises that you try to try with clients?
I'm sorry, can you repeat that?
Are there any common exercises that you try with clients, or is it each
Uh,
individual
it's
specific?
it's pretty individual. Like I said, when I do start strengthening, once they kind of have an idea of the nuances of their curve, because if they don't start with that, they're going to use their curves to do every exercise because they're using their curves to do everything all day. So we have someone come in from CrossFit or yoga, whatever, and we strip away all that movement first and get down to the subtleties of the scoliosis because if we pick up a kettlebell, we pick up any resistance, they're going to go into those curves first because that's what's the easiest and strongest for them. So we back everything up, and like I said, that's where the subtlety of the exercise sometimes just goes right past people and they feel like they're not doing anything. But they're working so deep to start with. So typically I'm starting with that posterior chain kind of work. And I like to do supine so that they have a lot of feedback on the floor, on the table, on props and wedges, so that they are not just compensating their way through. So I don't get them upright for a few sessions. So supine posterior work is where I'm starting, and then going into our antagonist relationships with psoas and the hips and all that good stuff. So there's not a set prescribed, no. It's a very individualized work.
Excellent. And I say thank you.
Well, you could just go to your local PT office and get whatever the protocol is for that particular symptom, right?
Yeah.
There is that, which they totally have their place and they help so many people, and I totally understand that. But oftentimes I get someone from PT and they're doing exactly the opposite exercise that my training tells me they should be doing. So, you know,
Yeah, we can all relate here.
yes, yeah, I knew you could. It was safe to say that, I think.
Well, thank you so much, Miss Amy. I think that Heather's going to jump on. We appreciate your time. This is great. If you guys have anybody with scoliosis or scolio Pilates has been wonderful. Miss Amy has been excellent with my patient. She's been so helpful as well. I know that she's a wealth of information. If you guys have any questions, I would assume that they can reach out to you.
Absolutely. Can
Perfect.
you share my information with them or
Yes.
website or something? Okay.
Yes, we will.
Okay, perfect. Thank you guys so much. I'll stop sharing my screen now. Thank you all for your time. And please reach out if you have any questions or find a Scolio Pilates practitioner in your area. Thank you.
Thank
Thank you.
you. All right, our next webinar is going to be November 7th at 1 p.m. Eastern Time, and it will be Dr. Mark Morningstar And his topic is you're using neurotransmitter biomarkers for idiopathic scoliosis progression risk. Watch your emails. We will be sending out info about that within the next few days.
Thank you.
Thank you.
Thank you.